Okay.
Setting it up.
Okay. On my screen, it says live.
Okay.
On the Zoom screen.
Okay.
I don't see it popping up on Hudson on my Facebook.
On Facebook yet, right? So we're getting there.
Okay, but I do see it now. Screen, it says live. Yep.
Okay, hold on. One moment. Please hold.
The screen, it says live.
Okay.
On the Zoom screen.
Okay.
I don't see it popping up on, but I do see it now.
Okay. We are live.
Okay, cool. Yep, I see it live on my phone at least. Okay, cool. So awesome. So we are here for our Monday, Mythbusting Monday. And today we're going to talk a little bit about pain with sex. So May is pain awareness, pelvic pain awareness month. Mm-hmm. So this is just one small topic on pelvic pain. Certainly there are other types of pelvic pain, but this is what we're going to talk about today. So I'm Zazu, Cioce. I'm a pelvic health and orthopedic physical therapist working with Miss Geri White, Hudson Valley Physical Therapy. I'll let her introduce herself.
Thank you. I'm Geri White. I'm the owner and founder of Hudson Valley PT, and we specialize in pelvic health PT.
All right, so let's talk. We have a few myths to bust here, and so we'll just start with the first one. So I have to deal with painful sex after having a baby. Well, not necessarily. So pain with sex is never something that is considered normal per se, unless it is something that you would like in your sexual experience. For a lot of people, it is not. And for a lot of people, they don't know that they have any other options. Well, you do have other options. So there are lots of things that we can do to try to decrease and eliminate your pain with sex, even after having a baby.
Right. Good. And point number 2, I have to deal with painful sex during and or after menopause. And no, that is truly a myth. There are vaginal tissue changes that occur with peri and menopause age. So, and yes, they might be contributing to having painful intercourse, but you should not be having any pain with sex during these years. So, and there are things that you can do about it, and we'll talk about it in the next slide.
Definitely. And so, right, last one we've got that we kind of hear a lot, and I know I certainly heard in my life, is it always hurts the first time you have sex. And that, while it may be something that happens to a lot of people, especially because the first time for most people, we don't really know what to expect because we've never engaged in penetrative sex before, and that's what we're talking about specifically here. And I think that's where a lot of that kind of misconception comes from, is just from the lack of education around it, especially before doing it yourself. So it's just like anybody else. There is, your body has a specific way of prepping for penetrative sex in both females and males. So, our first 2 questions, and I'd say even the third one, is more specific towards females, right? Just because these are the experiences that a lot of females have. But certainly we should know that also men can have pain with sex as well. Right. But a lot of it is knowing how your body is supposed to naturally work, both if you're a male or a female, how the sexual and arousal responses should work if you're a male and if you're a female, and being able to help prep yourself for that type of experience, and know what's going to help make that experience better and what's not going to help make that experience better. So
Right.
what do you got with that, Geri?
Right. No, exactly. So again, it depends on, the first time having intercourse, who your partner is. If you're comfortable with that partner, there's so many factors that are involved with the first time having penetrative intercourse. So yes, it might be painful, but again, it really depends on a variety of factors, and really should not be as painful as people say, as people have reported to us. So there are definitely factors that you need to consider, as Zazu said, with again, could be position, could be prepping, or the knowledge base that you need to know with arousal and intercourse and all that. So there definitely are a lot of factors that play into that.
Yeah, that one, I mean, we could have a whole conversation on that.
Yes, we could.
And I would love to. So if
Yeah.
anybody wants to have a conversation about that, let us know.
Yes.
So, okay. So just some common issues that we will help people with that kind of come to our clinic or see us virtually. And so there's a lot of common experiences that there are a lot of things that we can do to try to improve. So the first is pain at the opening. So if you're having pain with penetration, vaginal penetration, and you're having more pain with the initial penetration or the penetration at the opening of the vaginal canal, that is something that a lot of times has to do with more of the outer or superficial pelvic floor muscles. And that is an area that we kind of zoom in when we have someone who is saying that they are experiencing pain with that initial penetration, or with that more at the surface level, not as much with deeper penetration. Certainly, there are people who have the second bullet point who are having more pain or more issues with deeper penetration. And it's not necessarily the initial penetration or the more superficial penetration that hurts. It's more of like the deeper thrusting. And that tells us that, okay, there is another group of the pelvic floor muscles that are implicated are those deeper layers or the deepest layer. So that second and third layer of pelvic floor muscles. And also what we tend to think about is, okay, so part of that natural sex physiology that should happen with the vagina is with the natural lubrication that should be happening. Also, the vaginal canal should actually be almost like opening a bit at the deeper level, and that's your body getting ready for deeper penetration. So if you're having pain with deeper penetration, is it that there's not enough preparatory work, that enough preparatory time for your anatomy to be able to prepare, and so that you can have an enjoyable experience? Certainly, there are other factors. Maybe there's some pelvic floor specific pain happening at the deeper layers. And certainly, what Geri touched on with the last bullet point of just even the pain in general, whether it be opening or deeper layer, or some people have both, can also be positioning, comfort, comfort with your partner, how safe you feel with your partner, all of those types of things. So those are the things that we kind of dive into, and we will want to do an assessment of those pelvic floor muscles in each of those layers, see if there's any tender points that we can find just even right without being in that context of sex, and then trying to work on those areas specifically, and then looking at the actual sexual physiology of, okay, are we giving our body enough time to prep for this, or can simply incorporating more intimate touch or more foreplay prior help with basically the entire experience, including lubrication and how the vaginal canal needs to do what it needs to do.
Right. Exactly. So the third bullet point is increased tension in the area. So tension in the area could be from so many different things. So you've got, your hip joints, you've got your low back, you've got the perineum, which is the area between your vagina and rectum. So if you are postpartum, if you had some tearing there, if you had some stitching there, that might most probably will cause some tension in the area. Or even if you've had issues, orthopedic issues, some an old time hip injury or an old time tailbone or low back problem, that might increase tension in the area, which will then increase tension in the pelvic floor muscles. So we do look at the whole picture down there to see what are the contributing issues or factors causing you to have pain. And then the next bullet point is expectations of pain and mindset. Yeah, so that's a big one. So if you've always experienced pain with intercourse, then your expectation will always be, I'm going to have pain. So what happens with pain is you tend to guard, what we call it a gardening, a response to help protect yourself, a protective response to the pain. So everything will tighten up. And so your expectation is going to be painful. So I'm just tightening up and it'll make it, the whole activity will be painful for you, as well, uncomfortable for your partner. So it's really mind over body, thinking about it that way, just to make sure that, again, the comfort level, the preparation prior to what Zazu was saying with foreplay, and just knowing that you can actually help with the activity of pain itself once you see us, in terms of what we can do to help kind of relax the tension and the tissues in that area to help with you expecting a more pleasurable experience. Anything else to add to that?
Yeah, I would just say that, just like right off of what, like exactly what you said is like, if you, it honestly, right. What's that saying? It's like once bitten, twice shy. Right. So you have a painful experience, even if you just had it once, and
Right.
that next time our bodies are built for survival. And so if we experience pain, that's because our body is perceiving that there's a credible threat of danger to us in whatever context that we happen to be in. If you happen to be in a context of having sexual, experiences and having pain, then your body is going to take the data from past experiences to extrapolate what can happen with this future experience. You don't even need to be actually having penetrative intercourse to experience pain in those areas. For some people, it's even just the thought, right, and they get pain in that area. So then you think, okay, well, you're not in that situation, but yet you're still having pain. And that is how powerful our brain is at trying to protect us. So what we have to figure out is, how can we give our body and our brain more data, more like joyful, more safe or safer context for sex, so that that protective mechanism of creating pain isn't always the output that your brain and your body has. And so, right, if you see us, we can help to give some positive experiences, in the sense that, that area doesn't always have to be associated with pain. If we teach you how to do a certain technique, if we, give you a certain, like exercise to do, and that's not painful, all of those are data points for your brain to then take from when you're put back into the context of having sex. And so eventually, right, like, we need to also create positive experiences when you're in that sex and sexual context. So that again, your brain doesn't automatically default to I'm in danger.
Right.
I need to create pain.
Right. Exactly. So going to the last bullet point, unable to penetrate, could be again a variety of things. So what Zazu was just talking about, the expectation of pain. So to have penetrative, anything to penetrate in that area, you're going to be tightening up. So so that could be it. So your mind, body, mindset prior to the experience, or maybe from prior experiences, right? Will make it difficult for any type of penetration to occur. But then you'll also have your physical limitations, which will be your pelvic floor muscles and all the muscles we talked about in the area, the hip rotators, even the posterior pelvic girdle muscles, and even your inner thigh muscles. So there is definitely a lot of factors that are contributing to the whole sexual experience. So that might be causing your pain symptoms. So we just wanted to touch upon these points and bust these myths today. And if you have any questions, yeah, we'd love to talk about the subject because it's very important. So, and just feel free to reach out to us. And we'll see you next week, right? Next Monday for Mythbusting Monday. Anything else to add?
Have a great week, everybody.
Yeah, have a good week. Bye.
Bye.